Sound check, sound check, sound check. There we go. Folks, let's go ahead and do a video on heated high flow oxygen therapy. That's Vapotherm or Airvo, depending on which brand your hospital has, and maybe both. They're both good systems in my opinion. I'm going to share sound, optimize the video, and then try to share the correct window. Waiting for that to pop up. There we go. Okay. So that is the Vapotherm system you're seeing a picture of there. Um, it really became instrumental in hospitals during COVID. What those patients needed was oxygenation. Usually it was not a ventilatory problem, usually it was an oxygenation problem. So Vapotherm and Airvo just became, life-saving and better in many ways than mechanical ventilation. Yeah. So there's a picture of the device. The bag you see hanging there is sterile water. Careful not to mistake that with saline. If you use saline, you're going to have a salty mess. And I saw it happen once when some nurses were trying to use a Vapotherm. It's got to be sterile water. You simply puncture the sterile water bag. The chamber fills automatically. You don't have to measure the amount of water that you put into the chamber. The chamber does need to fit very securely inside that case. And the main controls you're going to deal with are temperature. This one is set for 37 degrees or body temperature, 37 degrees centigrade. The oxygen percentage, this one is set at 35, and the liter flow at 40 liters per minute. That sounds like a lot, but that is okay. That flow rate is okay because it is fully humidified and heated to body temperature. All right, so let me take you through the steps here. The patient is wearing a nasal cannula that's fitted to about 1/2 the size of their nares, and that works well to provide heated, humidified oxygenation, and probably does provide some level of CPAP in addition. We can't measure the CPAP level, but it probably does provide some, and we can actually see that on X-ray. So um, here we go, Vapotherm heated high flow. I'm going to take you step by step. I'm also going to give you a link to the Vapotherm company video, which does a very good job of explaining this. I just want to make some of my own comments here. Lessons learned, you might say. Okay. First, plug in the 50 psi oxygen line into the wall outlet. If you have a 50 psi air outlet, then awesome, just plug into that. Also, many of us do not have piped air throughout our facilities, and we wind up using a compressor. In that case, you've got to have the compressor on and the oxygen plugged in. We say gases before go. Because if you try to start the Vapotherm without both oxygen and air supply, it will punish you. It will not work, and it will make you start all over. So gases before go, oxygen and air, either piped air or a compressor. Assemble a disposable circuit, which is self-evident. It only fits together one way. Open the Vapotherm door that's on the side of the machine, and you can see that picture there. That opens up and the circuit is installed. It must fit tightly. You actually push down on it pretty hard to make sure there is no gap and that it is tightly seated in the system. The little Vapotherm company video does a great job of showing you that. Spike the water bag, release the clamp, and then fill it with water. It will stop automatically. Once about 250 milliliters have come in, then it will stop. Let's see, next, select a cannula with prongs which are approximately half the size of the patient's nares. That allows for, a good fit, but also some air movement around the cannula. For most patients, it's the one just labeled adult, just adult size. Yeah. We can do it on kids, and that is a separate circuit, a different circuit. Rotate the setting control knob. Now that's the knob that the therapist is touching in this picture. That control knob will just about change every setting on the Vapotherm. You have to push it before you do anything. All right. Press and release the run standby button to initiate gas flow. Now you're going to see a flashing green light, which tells you that it is, in fact, warming up and getting ready to operate. I'd say that warm up takes about 5 minutes on average, about 5 minutes on average. Let's see here. So you see a flashing green light, but eventually it's going to turn solid. Um, and that will tell you it's ready to put on the patient. As far as settings, these are my settings. And, some people disagree with this, but I've had good experience with starting at 30 liters per minute, 100% oxygen for COVID, 36 degrees, not quite 37. Sometimes the patient thinks 37 is just a little too hot. Yeah. But then move up to 40 liters per minute once the patient has acclimated, and you can do that usually after about 1 hour. For COPD patients, it's quite different, maybe 30 liters per minute, 40% oxygen. The temperature is the same, but then move to 40 liters per minute after 1 hour. So the difference is the oxygen percentage. The system is heating, and you wait for the green light to stop flashing and become solid or continuous before you attach the cannula to the patient. Refer to the troubleshooting guide, which is hanging right on the Vapotherm. And for standby mode, you can press run standby for 3 seconds. You can't just bump it, you've got to press it and hold it, but then it will go to a standby. Yeah. And let's see here. If therapy is completed, you can unplug the system from standby. There's not so much an on-off button to Vapotherm. And quite a few times over the years, I've gotten calls from nurses who would say, we can't find the off button. Well, there's really not one. You just go to standby and you unplug when you're done. Now, this video that I just recorded, in addition to the Vapotherm company video, should give you everything you need to operate this modality. All right, we're going to stop this recording and put it in the course and send it to your other instructors.